Hello, everyone, and thanks for joining us today. My name is Dr. Jeb Teichman. I'm a pediatrician, and I sit on the board of directors for Families Fighting Flu. I know firsthand the value of vaccines as a pediatrician, but also having lost my son, Brent, a healthy 29-year-old who was unvaccinated, to the complications of influenza. This panel discussion is a premier event of the Adolescent Immunization Action Week, April 1st to 5th, with a goal of spurring action among teens, parents, and healthcare providers to ensure adolescents stay up to date on all recommended immunizations. On this panel discussion, we'll have multiple young adult experts with a background in public health to talk about what you can do as a young person to advocate for vaccines, others' well-being, and media literacy within the public health space. Joining us today will be a panel of first on the panel is Arin Parsa, Eric Stein, Madeline McNee, Noah Louis-Ferdinand. I'll let them introduce themselves in that order.
Hello, my name is Arin. I am a high school junior in California. I am from San Jose, and I'm the founder of Teens for Vaccines, which is a youth organization dedicated to educating and empowering teens for the life-saving power of vaccines.
Thank you, Arin, and welcome. Eric?
Hi, I'm Eric Stein. I'm the marketing, communications, and program specialist at Families Fighting Flu. And vaccines are something that's near and dear to my heart because I've also experienced a loss, like Dr. Teichman. I lost my older sister when I was very young, and she was very young to the flu. And at the time, it wasn't recommended that everybody gets vaccinated for the flu, everybody 6 months and older, like it is now. So it's very passionate. I'm very passionate about sharing my interest and making sure that everybody gets vaccinated.
Thank you, Eric, and thank you for sharing. Madeline?
Hi, everyone. My name is Madeline McNee. I'm an intern with Unity Consortium. I'm really passionate about vaccines, and I'm super excited to be talking about a lot of the topics surrounding Adolescent Immunization Action Week today on this panel. I know we have a great group, so thank you to everyone who's watching today.
Thank you, Madeline, and welcome. Noah?
Yeah, hi, everyone. My name is Noah Louis-Ferdinand. I'm the communications coordinator for Voices for Vaccines. We're an organization that does a lot of kind of peer-to-peer advocacy and education, so kind of empowering people to talk about vaccines and kind of educate their loved ones on why they're important.
And thank you, Noah, and welcome. So let's get started here. We're going to start off with the first question for the panel and for Maddie in particular. What are the benefits of vaccinating young people?
Yeah, thanks so much. So first of all, we know that vaccines have saved more lives than any other medical intervention in history. We've been able to get rid of smallpox and polio through vaccination, and still today, vaccines have been an incredibly important public health intervention. With the recent COVID-19 pandemic, we saw how vaccination played an important role in reducing the spread of illness among young people during the pandemic, especially for adolescents and young adults in schools. And the use of preventive health measures like vaccination really brought communities back together. And we saw students being able to return to school and feel confident that they would be protected from COVID. So with all the many important things that young people are doing in their lives, vaccines are super important to protect against serious illnesses or reduce the severity of illnesses if young people do get sick.
Thanks, Maddie. Arin, do you have a comment?
So, vaccines help us all be safe from preventable diseases and live our lives without having to worry about spreading disease to our families and friends, especially those who are immunocompromised. And additionally, I think the pandemic has shown us that not being vaccinated can cause significant disruption in terms of not being able to enjoy extracurricular activities or time with friends, etc. In short, I would say getting vaccinated and staying on top of vaccine schedules is very important for leading healthy and happy lives. And I would also highly recommend young people to take initiative and talk to doctors and parents about vaccines and health in general.
Thank you, Arin. Noah, why should young people care about vaccinations?
Yeah, when we talk about why young people do or don't care about vaccination, I think the big thing, in vaccine advocacy, we focus a lot on the misinfo rabbit hole, and especially with COVID, a lot of politics and stuff like that. I don't think that's as important for younger people. I think, and I can speak for myself a little bit, because before I got into public health work in 2021, I was not somebody who felt especially strongly about vaccination. I wasn't anti-vaccine or anything. I was just very kind of ambivalent, apathetic. I didn't get my first flu shot actually until the pandemic. I just thought I didn't want to get another disease, so did it then. Obviously now I'm quite emphatic about doing it, but I think the reasons were pretty similar to a lot of young people. One being that, you feel kind of a little bit invincible yourself. You don't feel like you're at super high risk of much of anything. Most of your friends don't have a bunch of health issues, right? It's not something that's top of mind for you. And I think when you're at that age too, you're, whether we admit it or not, a little bit self-oriented. So you're kind of thinking about what directly impacts you rather than this broad, kind of abstract concept of herd immunity. And that shows up. I think all those things show up for young people. So for example, the flu shot for young people, I think only like 30% of 18 to 24-year-olds get their flu shot. And I was one that did not beforehand. And so I get that perspective. I think one of the ways that we can really get young people to care about those other vaccines, because they are important, is to really focus on the ones that impact them the most. One that I find is incredibly important and is really resonant is the HPV vaccine for young people. This is something that will impact your risk of cancer for the rest of your life, and you need to get it. There's some benefit after the age of 20, but you really need to get it when you're a young adult or a teenager. And I found, again, I didn't care a lot about vaccination. I didn't know that there was a virus that caused cancer until I was 22. Now, thankfully, my parents vaccinated me, but I found that message is incredibly resonant to young people when they find out that that is something that they can take control of. And so I think focusing on the vaccines that are a lot more salient to younger people can really kind of garner interest. Meningitis is another good one. Obviously, that impacts young people. But another thing too, I think this is really interesting. With flu, there's a little bit of ambivalence, but you can make young people care. There was an interesting study from the National Foundation for Infectious Diseases. They looked at what were the most effective ways to get young people vaccinated for the flu. And the number one way was to have food at the event, which is not surprising for most college students. So, make it easy, make it convenient, but also, again, focus really hard on the messaging about the vaccines that I think are going to be most relevant to them.
Yeah, I'm gonna echo your comment, Aaron. And Brent thought he was invincible. Throughout my career, I would bring the flu vaccine home to everybody and administer the nasal vaccine to everybody at home. But when they're 29 and they think they're invincible, you can't drag them by the hand anymore to get their flu shot. Brent had it on his to-do list, but he never got it around to it.
Absolutely.
Noah, do you have a comment?
Yeah, I want to echo everything that you guys said. From personal experience, I went to university at the University of Tennessee, which, as Noah mentioned, that sometimes that vaccines can get politicized. I think that I had roommates who weren't necessarily anti-vax either. They just said, why do I need to get vaccinated? It's the immunocompromised people, it's the older people that are really going to be affected by these sicknesses, these illnesses, these diseases. And while that is a lot of time the case that they're going to be more affected than you, it's still, a vaccine is the best way to protect yourself, even from just getting, bedridden for a longer time than normal. I remember when, the flu went through my campus, and I told everybody in my apartment to get their flu shots, and nobody listened to me. They all, thought I was blowing smoke. And I was the only one that wasn't bedridden for 2 weeks. It can really take a toll on, your life in general. It'll put a full stop on things. And just because you're not going to be the one that is necessarily going to have major complications, which, you never know, the best prevention is to get vaccinated. You never know what's going to happen. And obviously we hope that everybody stays safe and healthy. Like we said, the best way to prevent that is to get vaccinated. And B, even if you don't think, oh, something terrible is gonna happen to me, it could still, something like the flu could still take you out for 2 weeks. It could be devastating. It could take you out of real life, and that's something that we want to avoid. We want everybody to be safe and healthy at all times. And it obviously stops, like Noah also said, it stops it from spreading to other people, like your elders, your friends, your family, your professors, anybody like that. So it's protecting you as well as protecting the community and people around you.
Thanks, Eric. Noah? Given the mistrust in public health since the pandemic, how do you engage in positive health-related conversations with other young people?
Yeah, I think a lot of the mistrust during the pandemic, particularly for those who are younger, stems from one particular thing that affected all of us, and is a very real loss, which is that we kind of had to give up 2 years of our life. Prime years of your life. Like for me, it was my college experience. I lost 2 years of that. If you're a teenager, it's 2 great years with your friends. Obviously, it wasn't all completely locked down. That's an exaggeration to some extent, but there was a loss there, and that's real. And so I understand that. There are two things you can kind of take from that, of course. One is the interpretation, I think, is correct, of course, that we did this for a good reason. We participated in public health. We waited for a vaccine. We protected other people. But that's not how every young person feels. I've met plenty who feel, this was unfair, or why can't I live my life, or all sorts of things like that. So I think you really need to address that first. There's quite a bit of misinformation in our society. I think, unfortunately, over the past few years, this breakdown of the concept of herd immunity, of community immunity. There's an idea, genuinely, I've met a lot of young people who think this, that, if the young people could just live their lives and the older people could have sheltered, or, we did a focused protection of those who are vulnerable while everyone else lived their lives. This is a shockingly common idea that does not comport with how diseases work. And so I think that's true of any vaccine-prone disease. That was true before the pandemic, of even flu, for example. But it became stunningly clear with COVID, and there's plenty of evidence to say that. There's this graph I show people that's really interesting. It's a heat map, and so on the, I guess, y-axis, I don't have a visual here, but the y is the age of the age demographic. The x-axis is time, so it's how many cases there are at a certain point in time. And you can see the color is how many COVID cases are in that demographic. So it's young people. It starts off, it's like a perfect triangle. Young people have cases first, and then you see it go up and up and up until people are like 65 plus now have COVID. It's everyone in the community, after 2 or 3 weeks. And so I think just reestablishing that, diseases do travel throughout the community. We're all on the same team. That's kind of how it works, and we all have to participate. That concept is important because I don't think any young person wants to think they are necessarily harming another person. I think it's just easy to believe that, or easy to forget that we affect others. And so reinforcing that concept, I think, is really important. Again, especially after the pandemic, where it's kind of been forgotten a bit. The other thing I will say is that, the pandemic was a very individualized experience. People were kind of at home listening to media that kind of reinforced views they might have had. So if you had a negative view of public health or felt badly about what was happening, and then you had news that reinforced that, or some YouTube video or whatever media you're consuming, I think, for me to have a conversation with that person, I need to bring things back down to earth. Really see where they're coming from and kind of, go through each of their concerns. So it's me and them talking, not me and them and some YouTuber and Joe Rogan and whoever. Like, we need to be having a conversation. So I think to reestablish rapport and bring things back down to what actually happened, I think, and make it again, because I think there's a genuine emotional loss that you both share with that, right? So connect on that level. I think just to make it more personal helps quite a bit.
Thanks, Noah. Arin, you got a follow up on that?
Yeah, so just to kind of jump off that, so I'd say I find one-on-one conversations, whether in person or on social media, probably the most effective, since young people often have very specific questions, and I think sharing our own personal stories is highly powerful. Another important aspect in this is to not judge people for their beliefs. We should have conversations where there are no prejudices, and I believe leaving the door open for future conversations, especially if someone is hesitant to even have the conversations in the moment, is very important, such that we can continue the conversation forward and make sure that we get to everything that needs to be addressed in the conversation.
Thanks, Arin. Eric, how can you distinguish good information from misinformation about vaccines on social media with all the noise that we have going on today?
Yeah, that's a great question. It's super important to be able to tell whether what you're reading is credible or not. And there's a couple things that stand out to me. First is you need to check your sources. There's a ton of great sources on vaccines. You can go to the CDC, you can talk to your doctors, and that sort of thing, especially on social media. It's really tough because there is a lot of noise, like you said. And I think that, sometimes people might be able to appear or pose as something that they're not. So always check your sources, make sure that, follow up on who's writing the article that you're reading, who's posting, and what their agenda might be. Obviously, we like to think that everybody has the best interests for everybody, but that's not always the case, unfortunately. Another thing that I would say is make sure that you're doing your own research and reading the full article. There's an article that really stood out to me recently that I read, and the headline of the article was "People born in October are less likely to get the flu," which is not true at all. What it really said, if you read the entire article, was that if you're born in October, you're more likely to have your yearly checkup in October, which is a built-in time for you to get your flu shot. So then you're then they're in fact more likely to get your flu shot, which is more likely to prevent you from getting the flu or serious flu complications. But you wouldn't have been able to tell that unless you had read the entire article. And I think too often in today's society, you read like the 250 characters where you don't click on the link, you just read the headline. So it's important to make sure that you're following up on whatever you're reading. And like I said before, there is a lot of noise out there. You should be questioning what you're reading. Obviously, everybody is, there's a lot of articles out there trying to sell something or trying to push something. You know what's best for yourself. We all would love you to get vaccinated, and you should get vaccinated. You know what's best for yourself, and you should be second guessing everything that you read, because in today's day and age, you just can't tell. And so we always say, go to the CDC website, WHO, health services, human health services website. And again, talk to your doctor. You should listen to science, and make sure that another thing that you should do is make sure that what you're reading is actually a scientific journal or scientific article. I think there are sometimes that people just use big science words or science jargon, and they can pose as a doctor or somebody who knows what they're talking about, when really they're just kind of putting words out there and hoping that whatever they're saying sticks to the wall. So do your own research, make sure that you're following up, and check second sources too.
Thanks, Eric. Maddie, do you have a follow-up comment? And then I'm going to comment.
Yeah, I love what Eric was saying about checking your sources. I think one of the best ways to distinguish between good and bad information online is by checking where it's coming from. And also, medical professionals are gaining a lot of traction on social media these days with TikTok and Instagram, which is really great. They're able to share a lot of fact-based information in a really engaging way. So I think that's one way that social media has been able to benefit young people in learning more about vaccines. And medical professionals often share where they're getting these facts from, whether that be from scientifically published studies, as Eric was talking about, or from agencies like the CDC or the WHO. It's really important to be checking where information is coming from. And also because there's a lot of fear-based messaging coming from those who are not trained or knowledgeable on these topics, who end up spreading mis and disinformation about vaccines. And this can be really detrimental to the trust that has been built up around vaccines. So it's really important to be checking where information is coming from, checking whether who you're talking to or who you're learning from is a credible source. And I wanted to mention that all of the organizations here today are really, really great resources to learn from online. So Unity Consortium, Voices for Vaccines, Teens for Vaccines, and Families Fighting Flu. These are all really great online resources with fact-based, credible information that you can be learning from. So if you're ever unsure about the information you see someone sharing, it's always worth double checking from a source you know is credible and has reliable information.
Thank you, Maddie. And I want to follow up on something that Eric said. A trusted health provider is maybe your most important resource for accurate information about vaccinations. And if you have concerns, it's appropriate to question your provider. Bring those articles with you. Let's have a discussion. This is what I did for many years in pediatrics. Maddie, why is it important to ask questions about vaccines as young people?
Yeah, so going back to the point about good versus bad vaccine information online, it's always good to have questions. Whether you didn't understand what someone said or whether you want to learn more, we know there are always going to be questions, and that's okay. That's a good thing. It's actually important to get the answers to these questions because young people are able to then engage with their peers and relay this information more clearly. And in our classes, they always say, if you have a question, there's bound to be someone else who has the same question. So it's good to be asking questions and getting the information so that you can engage with in those discussions with your peers. And by taking the time to learn about vaccines and get answers, you also then have the ability to serve as a vaccine advocate amongst young people. There's a lot of information out there about vaccines for young people, and asking questions helps us feel more confident as decision makers for our health, which is the most important. So whether it's a conversation with parents who can help guide you in navigating scientific research, or talking to a healthcare provider, they want to support you in asking questions. As Dr. Teichman was mentioning, they want to be part of that discussion. So asking questions is the best way to start.
And if I
Thanks,
can-
Maddie.
Oh.
Go ahead, Eric.
I was just going to follow up and say that, we are the next generation of thought leaders, decision makers. And so it's really important for us to stay informed, especially because, I think oftentimes people say, well, I'm just a kid. Why should I care? You should care because in the next 10 years, you're going to be the person that's, helping your siblings or your eventual kids, or those people that you're going to be taking care of them. And you want to make sure that everybody around you is healthy and that you're making the right decisions for everybody else too. Like I said, we're going to be, the next decision makers too. Eventually, our generation is going to be the one that's in office. We're going to be the ones that's running companies. We're going to be the ones that are, the bright future leaders of the world. So we need to make sure that we have a responsibility that we're making the right decisions for everybody else. And that, as Maddie said, involves doing your research and making sure that you are asking questions to make sure that you know what's best for you and you know what's best for everybody around you.
Arin, where can you find trustworthy resources with credible vaccine information?
I would say that there are several trustworthy sources, such as doctors' offices, pharmacies, school nurses, science teachers, vaccine nonprofits, and state immunization coalitions, as well as state health departments. For example, for easy to understand sources, I would highly recommend blogs from vaccine nonprofits, specifically the Unity Consortium, Voices for Vaccines, and Vaccinate Your Family are great for knowing about all vaccines in general, while for specific vaccines, blogs from the National HPV Roundtable, Families Fighting Flu, and the Meningitis B Foundation are incredibly helpful. And I would also recommend having one-on-one conversations with doctors for personal advice and planning your vaccine schedule. And on the other hand, I would not trust social media posts and anecdotal conversations because they aren't research backed.
Good to know. Thanks, Arin. Noah, you have a follow-up?
Yeah, I just wanted to highlight two things. One I found is very interesting since I started doing public health work. The problem for a lot of public health organizations is that they need to find people to look at their stuff, not that it's not out there. Like there's a like they would be so happy if you found the resources, and there are so many organizations that just are trying to put their stuff out there. Like for example, I didn't know there was an organization specifically dedicated to hepatitis B. There's a hepatitis B foundation that educates like incredibly about the vaccine, incredibly about the disease, things like that. There's a lot of organizations that rose up during the pandemic. Dear Pandemic is a good example. There are so many different organizations to find. So any specific question you have, just do a little bit of research in the area. I think you will find just so many different excellent resources. But the second thing I would say is that, the CDC, organizations like that, they are great for often the information that for a lot of information that you need. I think for information that's a little more kind of like, week by week, especially like during the pandemic, where there might be like a specific myth that's out, just coming out of nowhere. Following the space of public health is really great too, because a lot of public health officials are willing to kind of speak as well on their own and give great advice. I work with Paul Offit. He's on the board of my organization. He is a member of ACIP, which is the CDC body that makes vaccine decisions, but he also does incredible science communication on like a week by week basis. He's on the news, he writes a blog, he does all this great stuff that breaks down current vaccine topics. So there is no shortage of people to give great information. I think just digging a little bit will give you so many great resources.
Okay, back to you, Eric. How can you advocate for the importance of vaccines as a young adult?
Yeah, that's a great question. One thing I've always, I'm in a little bit of a unique position in that I have a personal story. One thing that I've always noticed that you should just talk to people. I think a lot of time people are a little afraid to approach like the subject of public health and vaccines. And while you don't always need to share your own personal history, it is important to share personal experiences because that is going to cut through the noise sometimes, and that oftentimes is going to be a lot more effective at getting your point across than just saying, hey, follow this resource. Another thing is just be vocal. I think oftentimes you hear stuff only from maybe politicians or these big organizations or these big companies. And I think peer-to-peer messaging is super important because in the end, you're going to trust the person that you know, not the person you don't know. And so if you can, get to one of your friends and then tell them to pass that message on and so forth, that message is going to spread so much further than just saying, hey, check out this great article, or hey, check out what the CDC said. While those are important and effective and good to listen to, people ultimately again want to hear from people that they know. They know that they trust you, and you're going to be the one that is going to be able to relay that information better and make it more relatable to somebody than a big company or the internet might.
I think it's important to understand that people just want to be listened to. If they have concerns, if they're vaccine hesitant, they just need to express those fears, those concerns. And as an advocate, we need to listen to those and address them, and then point them where they can find the valuable resources. So important. That's why a one-on-one conversation is so important. And not forget the power of stories. That's what Family Fighting Flu is all about. We have a collection of families who have been severely impacted by influenza. And by imparting those stories to folks, it reaches home, and it's much more valuable than citing a bunch of statistics. But again, people want to be listened to. Noah, you have a comment?
Yeah, I just want to say I completely agree with that. And to go even further, in my personal experience, I don't just talk about it with friends. I have to like nag them a little bit. So, if I'm going to get my flu shot, I say like, hey, let's go together on this day or something, or try or I try and serve as a good example. So I'll post a flu shot selfie on my personal social media every year. Just things to really get people acting, because I find that just giving health advice is not necessarily something that people will just take in stride 100% of the time. So just being a little bit of a helper and giving a nudge can be helpful too. But the other thing I will say, I just wanted to add, I've seen a little bit in the kind of the public health space, this assumption that like we can just do messaging oriented towards young people and that will be enough. And it's funny because like if we were to visualize like the space of public health and the space of like young people's media, like a Venn diagram, there's very little overlap there. Like there is so little overlap between where public health is communicating and where young people are at online and social media everywhere else. It's funny, we started a TikTok, and TikTok is characteristically a young person's platform. And even there, almost all of our viewers are over the age of 35. Like something clearly about our content is still not resonating, even though we went to where the young people were. So I think you need to think really about, not just like being a public health person and then talking to young people, but as a young person, how can I go, and relate actually to my peers rather than, putting on my public health hat and trying to get them to do something. So I just think thinking through that lens is more important, just because public health people really, really struggle to hit that demographic.
Yeah, and it's important to, when you get vaccinated yourself, to share that with your friends, as I did. It's important. And let's talk about your concerns one-on-one. I think that's so important. Arin, how can you use social media to your advantage as a young advocate?
So I would say that social media is a great tool to use as a young advocate. I started Teens for Vaccines as I was helping teens on Reddit, and I connected them with trusted sources. And I also remember giving Reddit coins and awards to those who have posted their questions to appreciate their efforts in reaching out. And additionally, in parallel, I use Twitter to amplify trusted messaging and sources from 200 plus accounts. And these were from nationwide immunization coalitions, states' health departments, doctors, vaccine nonprofits, etc. And later, I expanded to Instagram, Facebook, and YouTube to reach young people like myself. And additionally, I would recommend TikTok and Snapchat highly because young people really respond well to visual and short content that includes personal and relatable stories. I would also add that networking with other advocates is very important because collaboration allows us to reach the most people we can. And it's also very important to stay away from negative comment threads on social media and to use time wisely to help spread positive messages instead of having to respond to negativity.
Thanks, Aaron. Maddie, do you have a follow-up?
Yeah, I think social media is an important way for young advocates to both consume and share vaccine information with their peers. As young people, we have a lot of friends on social media platforms, which means that as young advocates, we have a huge reach to share credible and fact-based vaccine information. And I think as young people, we don't always have the immediate trust of our peers on these topics. So it's always important to also be sharing where we're getting information from, as we've been talking about. That could be from organizations like Unity or Families Fighting Flu, Voices for Vaccines, or any of the amazing public health organizations represented here today, or other public health agencies who we know provide fact-based information like the CDC. And I think one last thing I'll add is that for young people, vaccines are not always top of mind compared to other health-related activities. So as young advocates, one of the important things we can do and one of the important actions of Adolescent Immunization Action Week is to be sharing where and when adolescents can get vaccine appointments. I love what Noah was sharing about, bringing friends along with him to get their vaccine appointments. And I think it's important for teens and young adults to be both on schedule and up to date on vaccines like HPV, Tdap, or meningitis. And it's also really critical to be thinking about those yearly vaccines. So social media can be a really great tool to help us as vaccine advocates to be able to share that yearly content, remind people that it's time to get their yearly vaccines.
Thanks, Maddie. Thanks, everyone. And thank you to our panelists for joining us today and providing insights on the value of vaccine advocacy. We hope that everyone's gained insight and learned about the importance of standing up and speaking out on public health and the importance of getting vaccinated as a young adult. Make sure to engage with all the important events happening throughout this week and stay in the know about vaccines. Be sure to visit our website that's on the bottom of your screen to learn more. Once again, thanks for joining us.